Hi everyone, my name is Ruth Wilcock and I'm the Executive Director of the Ontario Brain Injury Association. I want to welcome you to our multimedia podcast series. The mission of OBIA is to enhance the lives of Ontarians living with the effects of acquired brain injury through education, awareness, and support. We are so excited to have partnered with Headsup Concussion Advocacy Network and the former Ontario Neurotrauma Foundation to publish this multimedia podcast series. I would now like to introduce to you Ryan Sutton, who is the Executive Director of Headsup Concussion Advocacy Network.
Hi, my name is Ryan Sutton. I'm the Executive Director of the Headsup Concussion Advocacy Network, a nonprofit organization whose mission is to challenge the stigma surrounding concussions. One of the most effective ways that we have found to spread awareness and education on this injury is to share the stories of people directly impacted by them. That is why my team and I are so excited to be collaborating with the Ontario Brain Injury Association and the former Ontario Neurotrauma Foundation to produce this multimedia podcast series.
Hello, everyone, and welcome to a very special episode of the Sharing Experiences with Concussion and Traumatic Brain Injury series presented by the Headsup Concussion Advocacy Network, the Ontario Brain Injury Association, and the Ontario Neurotrauma Foundation. In this discussion, we are speaking with the 6 facilitators that moderated each episode, and we're going to learn a little bit more about their perspective and insights from the conversations they had during their episodes in relation to concussions and TBIs. Now, my name is Seth Mendelsohn. I'm the creative director of Headsup Can. I'm going to be moderating today's episode, and I'm very pleased to be speaking with these 6 remarkable individuals who all have experience helping people navigate through the recovery process. And I wanted to kind of start off and have you guys introduce yourself so that our listeners can get reacquainted with a bit about who you are and what your background is. And so I'm going to go based on the order that I see. So we'll start with you, Leslie Burkett, as we have 2 Leslies here.
Thanks. So yes, my name is Leslie Burkett, and I'm an occupational therapist in practice in Burlington, Ontario, and I'm an adjunct assistant clinical professor at McMaster University.
Awesome. Thank you. And we'll pass it over to the other Leslie.
Thank you. Yeah, my name is Leslie Rattan. I am a psychologist and I practice in both clinical psychology and clinical neuropsychology. I have worked at Toronto Rehab, which is part of the University Health Network for many years, working on an outpatient neuro rehab program and also work in private practice.
Awesome. Thank you, Leslie. Connor, we'll pass it over to you.
Hey, thanks. I'm Connor Massimo. I'm a physiotherapist in Peterborough, Ontario. And I work in private practice, and that's my connection with sports injuries and concussion through the clinic that way.
Appreciate that. And Steph, we'll pass it over to you.
Hi, I'm Dr. Steph Galer. I'm a family physician in Peterborough. I used to work as an emergency physician and have had some interest in sports medicine. And that got me into some involvement with concussion care.
Awesome. And we'll pass it over to you, Penny.
Hi there, my name is Penny Welch West. I'm a speech language pathologist and I work at Parkwood Institute in London, Ontario. I'm a lecturer at Western and adjunct professor at McMaster. I facilitate a return to school program, which is how I'm coming here today to talk about how students return to learn. Primarily, I work with college and university students and do stretch down into high school, but predominantly I support post-secondary students who are pursuing their degrees following injury. So that's a little bit about me.
Thank you. And last but certainly not least, Becky, we'll pass it over to you.
Thank you. My name is Becky Moran. I'm an occupational therapist and I work with Penny on the Acquired Brain Injury Outpatient Program at Parkwood Institute in London. I've been working on brain injury now for about 10 years, almost 11 years now. And part of my role is coming up with kind of creative ways of doing pacing and planning. And we recently just developed an app actually that we have using a point system that we use. So it's been very exciting to develop that. And I'm happy to be here tonight.
Awesome. Thank you all for sharing that. And clearly you guys all work in various aspects within the concussion and traumatic brain injury landscape. And, you know, throughout these episodes, we've gone to hear a little bit about each of your stories and your backgrounds, but I want to take this time and kickstart it with the first question and ask each of you, what was the moment or the experience that led you on this path that wanted to help people struggling with concussions and traumatic brain injuries within the recovery process?
Hey, thanks. So as a physiotherapist in private practice, I think, especially as you start working more with an athletic population, it tends to lead in that direction just naturally. You're going to work with teams. We work with hockey and lacrosse teams specifically. So obviously high contact sports, and you're going to start running into athletes of all ages that are suffering concussions during sport. So you have to kind of get up to speed if you want to be treating that population and helping those teams. And just growing up in youth sport and having a couple concussions through sport on my own, I realized that not everyone has the knowledge necessary to kind of help you through that process. So I think that sparked my interest in concussion and how it could be helpful moving forward.
For sure. Thanks for sharing. And Leslie Rattan, we'll pass it to you.
Thanks. Yeah. I, as a neuropsychologist, I mean, at the hospital, we would see some concussion patients, but I think my earlier experiences were with more moderate to severe traumatic brain injury. And then over time, through my private practice, I had more exposure. And then I guess about 6 years ago, I started doing some work with the Canadian Concussion Center and was helping facilitate some workshops for people with persistent symptoms, and had been doing that regularly up until COVID hit. And so that was a really great opportunity to really meet and see people who, were really struggling further out from their concussions. So
that's awesome. Thanks. And Steph, I saw your hand was raised.
This time I'll remember to unmute myself. So similarly to Connor, I think I've noticed over a few years of getting a little more interested in concussion is that a lot of us have gone through it, and it resonates a little bit more. And I remember during med school and as an athlete growing up, but more in med school, you're taught and you've read the books and you've taught certain ways that all the old textbooks used to tell us. And unless you stay on top of the research, you don't get the newer information. And I grew up playing soccer, and I played what I always was football in Australia. And I'd had a few dings to the head, and you got up and you go play again. And it wasn't until actually I was practicing in the Emerge, and it was an old man soccer Friday night thing, and it was not much of an injury. And I got knocked over, and I thought I was fine. And then I realized I wasn't the next day or the next day. And then 5 months later going, am I ever going to be able to run again without throwing up? So then I was like, I talked to different physicians, and I realized that I may not have been practicing properly. Practicing medicine and what my advice was. So I looked into it a lot more. And, from that, I realized, hey, there's a lot more education in the medical world. There's a lot of people out there that, we're not all telling the same message. And I think that's one of my big interests is trying to keep everyone on the same page to say, hey, here's what we should be doing. This is what the newest research shows. And it might actually be different next year too. So.
Absolutely. And I'm sure that's a common thing that we see with people who have concussions where they don't actually know that they're having it or experiencing it during that time. Becky, we'll pass it over to you.
So I think Penny can attest to this as well because we work together. But our kind of delve into concussion management and concussion work really stemmed from our patient population changed. We used to treat moderate to severe brain injuries only in our outpatient program because they were the ones coming from inpatients or physiatry. And then all of a sudden we started seeing all these people being referred into our program who had mild injuries, but struggling a lot. So we had to kind of almost play catch up with what's the advice, what's going on, let's try this, let's try that. So we were kind of learning as we went and trying to come up with really creative ways of helping these people because they were suffering from seemingly mild injuries. And so we had to learn as we went. And so it really wasn't something that we sought out. It was more of it came to us and it started as a trickle or a little drop in the sink. And then it became this waterfall of referrals that came in to the point where we had to put exclusion and inclusion criteria for referrals to our program as well. So, yeah.
Wow. Yeah. And Penny, we'll pass it over to you.
Yeah, if I can springboard off that, that was really well described sort of our journey here at Parkwood. But even before this, and it wasn't my intention, I had a position in my undergrad and graduate work supporting students in accommodated exams. So I was actually a proctor at Western, and I worked for student services, and I would proctor examinations for many students who had different sort of etiologies, and lots of them had brain injury. I don't know if I would have forecasted 20 years later, I would be writing reports that then supported these students for those very same accommodations that they now need. As Becky described, we definitely had quite a large, I say, tsunami or wave of referrals about a decade ago, owing to the things that she's described. And I was individually meeting with students, talking about different problems they were experiencing with reading and headaches and retention and how to study, how to leverage technology. They were struggling with a lot of the same things, and sitting with each of those individuals one-on-one. While it was great to be able to offer that, I started to realize there was a real need for peer support in here, and that the peer piece of this was largely going ignored. And I wondered if we would put students together, whether they might derive benefit from a simulated classroom experience in which to practice these skills and strategies and techniques with a supportive environment of people who understood exactly what they were going through. And that turned out to be far beyond anything else I do, the most important part of the return to school group. Getting people together. And I think this has been true, and Becky could nod, in every group that we run at Parkwood. I think we had underestimated the importance and the value of peers and putting people together who've had a shared experience. And so that's how we sort of found our way in the concussion work we do.
Awesome. Thank you. And Leslie Burke, I see your hand is up. Did you want to add as well?
Sure. My journey to work into concussion actually started when I was a relatively new grad, and I was working at the Children's Hospital of Western Ontario in London. And at the time, I was the only OT in the hospital, so covered soups to nuts kind of thing. But at the time, we had a neurologist, the late Jane Gillette, who was a fantastic pediatric neurologist, and she really started bringing along the pediatric brain injury program. So what I found was, for me as a clinician, that what I love about working in brain injury is the creativity that's required. So again, like many others, my journey started more with the moderate to severe. And over time, I've worked my way into the community. I still work with lots of kids. I work with adults and do the whole spectrum from the mild concussion and straight through to some quite severely injured folks. And I love the challenge. I love the ongoing learning. I think it's a fascinating field, and I think it's going to continue to grow and change, which is really exciting.
Absolutely. I suffered my concussion when I was in grade 12 and kind of didn't think much about it. And it wasn't until I met Ryan in university and we shared our experiences and had that, peer support where I realized how impactful it was. And now how I've gone through this journey with Headsup Can with him. I always find it fascinating to meet people and individuals like yourselves that have dedicated so much of their life to helping the people that are struggling. And it's so important and it's so inspiring to see. So I really appreciate all of the work that you all do. And, one of the fascinating things about this project is that we got to hear from a lot of people in each of your episodes from different walks of life. We got students, employees, caregivers, athletes, so many different types of people. So I want to ask you guys, what were some of the underlying themes that were present that you noticed during your discussion?
So I was facilitating the return to work episode, and I had the pleasure of having 3 participants. And I think what was really interesting to me was that one of the participants has returned to work full-time. One of the participants had returned part-time, and one of the participants was unable to return to work. And I think that's very realistic to get the whole breadth of experience. So I think that's one thing. Certainly, we know that the vast majority of individuals following concussion do return to work and can return to work early, and that's certainly advised. But there are, of course, outliers, and certainly individuals with prolonged symptoms still have the ability to return to work. So that theme came up in our discussion also. And I think one of the important things was talking about what were the supports that helped, and certainly family and friends and a supportive treatment team, as well as the workplace environment itself and the workplace's willingness to make accommodations. Those were all positive things that bode well for people's ability to get back to work. So those were some of the important points that came up.
Awesome. Thank you. Connor.
Yeah, so I was in the return to sport group and had some really high level athletes. A goalie who went to Harvard. We had an Olympic snowboarder on the panel, a high level football player, and a gymnast. And they're all doing different things now. They're all kind of moved away from that sport life as they've aged into university and into their careers. But I think the one theme from all of them that I kind of picked up was it hit a point in their recovery. All of them had prolonged symptoms where they either were told by a medical professional or came to this realization on their own that they needed to stop trying to compare themselves to themselves pre-concussion and kind of come up with this concept of a new normal. And they had kind of different strategies for that. One of the women mentioned that she kind of just realized one day, I've had symptoms for many years now, but had I not had this concussion, I would not be the same person I was 3 years ago anyway, right? So I can't, and I probably don't have that good of an idea of actually what I was like 3 years ago. Like, how can we actually measure that? So that's something that I talk to people a lot about in the clinic, is kind of becoming this new normal and working towards kind of your best self with concussion symptoms and hopefully working through them fully. But that was a theme that came up for all the athletes, was trying to get away from comparing yourself to your pre-concussion self.
Yeah, absolutely. And especially for high performers, that's a very important message. Leslie.
Yeah, thanks. Yeah, I mean, I would echo, I think, to some extent what Leslie and Connor were saying. I was fortunate to have 5 people in the group that I was moderating, and it was on support systems. So was fortunate to have a couple of individuals from OBIA, someone who had actually had a concussion, but also interestingly was at university, and her master's level project was around accommodations, and she was also working in the student accommodations at the university. So she had a really unique views. And then we had another individual from a brain injury association who happened to also be the mom of someone that had a severe traumatic brain injury. So it was a really interesting group to speak with about the supports that are needed. Also had a psychotherapist. That was the other person that I'm missing. So we did have, we talked about gaps and definitely how some people fall through the cracks. I think, there's often, there's been a lot of focus on concussion and sports, but there's, a lot of other ways that people sustain concussions. And so sometimes, depending on how people do sustain their concussion, it can be really difficult to access resources. And so certainly funding was another one of those things that came up in terms of just, publicizing it more, having sort of, concrete lines that, for example, that OBIA has, which is fantastic. And their peer support. We talked a lot about how it's so important for people to be able to talk, just as you were saying, running into someone that's also had a concussion, had similar experiences. And that's certainly been what I have experienced in the education workshops that we've done. Often people will, they'll be quite far out from their concussion and, just say that they felt so much less alone after having, met other people that are going through similar things. So I think that was, there were a number of different themes. Also, just one of the other important ones was just how concussion is often invisible, like, brain injury and other illnesses as well. But often, there's no obvious physical difficulties. So to, people's friends and even family, sometimes, you look fine. Why can't you do this? And that can really lead to a lot of challenges. So we had a lot of discussion around that. And also just the need for good interdisciplinary care when it's required, and communication between those therapists as well. So that touches on some of them anyway.
Thank you. And I definitely know for myself, if it wasn't for my mom, I'm not sure how my recovery process would have been. So that communication was so important to have with her. And definitely want to circle back on those gaps later on, but we'll pass it over to Becky.
So I think my podcast was about the lived experience. So having the lived experience of having a concussion. And I had my people that were involved, like my participants, were very young, and a lot of them were in school or going into different programming or just exiting school. And I think the main thing that I heard from them was it was so inspirational to see that despite having symptoms still, despite they still struggled with lots of different things, they were still following and pushing themselves to be the best they could be. They were still following those dreams, trying to pursue a career. And really, again, maybe not the way they wanted to. Full-time students, perhaps, they might have had to do part-time or do it a little bit differently. But it was so great to see how all of them were still moving forward, despite having ongoing symptoms and ongoing difficulties afterwards. So it was wonderful to experience that.
Awesome. And it's inspiring for other people that are listening that may feel like they can't get out of, their experiences, that they can move forward. And I think that's such an important theme. Before I move on to the next question, I just want to see if there's anyone else that wants to chime in here. Penny?
Yeah, so I was facilitating the Return to Learn talk, and a younger demographic there as well. I think by design, I didn't get to include any of the students I had supported. We obviously support lots of people, but I think by design, I got to work with a wonderful group of students who had not had the kinds of supports that Becky and I get to experience in an interdisciplinary team, as Leslie's discussed there a minute ago. And so there was a lot of floundering. It was hard to listen to be honest, at times, about the amount of struggle people underwent trying to get themselves to services, pay for services, and then the question marks they had about were the services the best services or the right services. I think there was just a lot of difficulty getting access to the right professionals and tying that all together. And so there were, again, someone else said this already, but years of struggle with I would imagine a lot of erosion of confidence that goes along with that, and lost time. When we think about the students' experience, these are people who had not got a career path yet chosen, and so their life is interrupted in ways that are different, I think, than others who maybe have a career path. They're returning to something familiar or something they know. So I heard a lot about trying to figure it out by trial and error, not having a good guide or a sense of others who could guide them into what was best practice or evidence-based. And so that was a real theme. And I think really that what came loud and clear to me, and I know this from our own work, is just how motivated the students are and how much they're trying. And I think a lot of them felt maybe they hadn't always been believed or hadn't always had supportive instructors or teachers or people who understood or who were in their corner. And so I think that was really a strong message about how motivated they are and that we are trying. So I found it hard not to dispense information as I was going through this with my group, and I see others are nodding because you really wanted to sort of help, knowing what we know. So I found that difficult, but the purpose of that podcast was to hear the experience and to hear the story, and I definitely know how well articulated this group that I was facilitating was, so I was glad for that.
Awesome. And I think, one of the great things about this project in general is that it shows people all of these different experiences so that they know that they can keep searching, for new ways to, as mentioned, interdisciplinary model, new ways to add to the recovery process. Steph, would you like to add to some of the themes that you noticed?
I had the pleasure of talking about the diagnosis. I did jot down a couple little notes, and it sounds like maybe a little bit different than some of the other podcasts. We didn't have anyone that came to it discussing about the experience of being diagnosed. We had an emerge physician, a nurse practitioner who's heavily involved with concussion care up north. So an emerge physician from Peterborough, a psychologist in St. Catharines, and then a pediatric sports physician who has, some fellowship work in concussion, so who has a lot of, academic knowledge and practical knowledge. So it was great to have him along. And I think one thing I think we decided is that it's sometimes difficult to make these diagnoses. It's not always clear cut as to what, because in medicine, there's a lot of things that can present very similarly to concussion. ADHD, anxiety are the two other ones that come ripping to me right now. And sometimes it's all three. So, I find as a physician that's really difficult. And sometimes that's when I often rely on neuropsychologists and some testing to go, okay, what are we aiming more towards here? I think the other thing that we decided that, we don't have a lot of resources for this. So I would agree with the concept of, and I guess maybe it's unbiased because I was a family physician, but I think that having a family physician or primary care healthcare worker, so usually an MP or a physician, as the quarterback of the care, I think that's really, really important. And then can make a diagnosis and then kind of go, well, what are we aiming towards? What are the biggest symptoms that we need to work towards here in helping with the recovery after we've taken, your typical basic first steps? And it's hard because a lot of it has to do with serial follow-up and it takes a lot of time. So, having someone come back for regular visits, and I think about return to school and return to play and now with the return to school, all the forms that need to be filled out, it's good that we're getting people back regularly because it is serial follow-up. I'm like, all right, where are you at these days? What are bringing on your symptoms? What can you do, symptom free? But a lot of family docs, are unable to bring people in. And it's not that a lack of want, it's just unfortunately to the fairness of the Western physicians that I think all of us felt frustrated with that component. But then on top of that, then the specialist care, that's even harder, medical specialist care, whether it be a physiatrist, neurologist, whatever, is really hard to get in. And we probably don't want to use their specialty care for your run-of-the-mill concussion, right? So I find that I could see the frustration from a patient with regards to that. And then also from the physician's component, we're frustrated. I wish we could provide more. And that's where, and people always talk about trying to set up a concussion type clinic or a program. And those come into roadblocks with regards to that too. Whether it be funding or interest or whatever. Would it be great? Yeah, it would be awesome. I'd love to have someone who is, really skilled and knowledgeable in this. And that's what they do all the time. So I think those were the big ones. And the other part is a lot of like psychiatry is that, because it is an invisible illness, we don't have great diagnostic tools. I wish we had a magic scan that went, whoop, press the button. Yeah. Hey, look it, you got that, but we don't. So, I think probably in the next 10 years, there's going to be a lot more where we can specify that type of thing. And maybe we'll come up with blood work or imaging or whatever. Maybe not, but I think we are going to come up with a lot more stuff.
Absolutely. And I see, Penny, you want to contribute as well here.
Mm-hmm. I liked your comment about the GP, Steph. I think that is really, that is the quarterback. And you really want a great quarterback who understands all the different roles and players. And I think one of the gaps I've noticed is certain disciplines, and what they're doing and what they're bringing to the concussion work, like in speech language pathology. Often people, when they meet me, they would give that little head tilt to say, I'm not sure why I'm here. And then as I start to talk about cognitive communication, attention and memory and reasoning and problem solving and reading, writing, studying kinds of things, then they're like, oh, like, where's that been? Where is the help been for that? Because that's been something that's keeping me from getting back to school or being successful. So I agree with you. It's so difficult. And the students I spoke to talked about the differences in the experiences, physician to physician. And I really agree, though. I think that is the quarterback and the person who can best sort of figure out what things are needed and when they're needed. The other thing I was thinking about as you talked about markers or indicators of concussion, it is so challenging because imaging isn't where it needs to be, and there's a lot of deliberation sometimes when we should just get to treatment because that's the most important thing from the patient's perspective. I don't know if we'll ever get a biomarker or something that tells us this. I always sort of think of it in the end, if we're going to listen to patients and sort of believe them and try to move them forward, I sort of say, here's the rope, we're all going to grab on, we're all going to go. And we're going to go together. And regardless of whether you've had imaging that shows this, if you're complaining about these things, it's consistent with sort of what others report with similar injuries. So I think those are good interesting topics.
The imaging component's interesting too, because, everyone wants imaging, right? They come in, they just scan my brain. Let's see, is there blood there? Or, and it's hard. It takes a lot of time to actually explain why it's probably not a good idea to do that, or why it's not needed, and why it actually might cause other issues, right? Sorry. And the other thing that actually came to me as we were talking is like about the multidisciplinary thing is that there's a lot of competing groups out there too with regards to diagnosis of care, and I can understand the frustration of someone who's suffering from an injury because they want a quick fix, and then they've got people out there advertising, and we can. And I find that very frustrating and hard because you don't want to, I don't want to discourage my patients. But there's a lot of people offering diagnostic type therapy or, first a type of diagnosis, and, we'll do all these questionnaires online and and like, we're going to come up with an answer. And, they think your clients and patients think they're doing the right thing. And I think about it how when I was a kid, my parents were, well educated. My dad was a teacher, my mom's a nurse, and they thought they were feeding me the right things. But, as a swimmer, they were giving me plates of pasta all the time. And now in hindsight, I'm like, what the heck were you guys thinking? And I think it's kind of that, like, people are, they think they're doing the right thing because this is the knowledge that they have at the time. So part of it is going to be knowledge dissemination and helping people make good choices.
Yeah. And I think, from the experience of the person dealing with the injury, it's almost harder when you have that actual like diagnosis, like you're going to be okay in 2 weeks, and then 2 weeks go by and you're still dealing with it. Whereas, the one thing that is very true is that this injury is nonlinear. It's invisible to everyone. That's not just your friends, your family. That also is your doctors. And we're still evolving with our knowledge towards it. And I think that's a really important thing to understand, that, it does take a team effort to try and get you back as, as Connor mentioned, maybe not who you were before, but a newer version. And I think, that transitions really nicely into our next question. And I want to ask each of you, what are some of the biggest gaps that you noticed within, whether it's just the entire concussion and traumatic brain injury as a whole, or your specific categories as we've talked about it throughout this discussion?
I was going to kind of throw this over to Steph at some point too, because just as a family doc, I think there was a theme. And again, some of these concussions for the athletes on my panel were 5 or even 10 years ago, but some were more recent, like within the past couple of years. And there was kind of a theme of just getting a real mixed bag of information at that primary care visit. And a lot of it being super dated information, but kind of written as gospel. Like, you've got to go rest. Don't do anything until you feel totally back to yourself. And some of these poor high-level athletes are sitting there thinking, all right, it's been 2 weeks. I'm in the dark room. I feel way worse than when I started. Where are we at here now? And then they start looking for other resources and maybe find out that wasn't the best info. So Steph, I'm going to toss it to you. What do you because I still see this where we practice. It's gotten much better in the past few years for sure, but I still see some of this really old school information. So what's my approach then to kind of navigate that delicately, to not try to throw shade at the primary care provider, but also let this patient know that maybe that wasn't the best approach from the hop.
Yeah, and that's a great point. And so a couple of things. One, I always think you should be comfortable calling a physician. You call their office like, hey, I'd love, with my client's permission, I'd love to have a chat to discuss this patient's care. And I've talked in different groups about this, and it's not always going to be well received. I will admit that. I think a lot of times it will, in that, hey, you know what? I've been caring for your patient for a while. These are the things that we're working on, and I'm just wondering, what your ideals are. And to tell you the truth, if they find out right away that you're like, oh, this guy knows what he's talking about, they're going to be like, yeah, you go ahead. Especially if this person is saying, hey, you should wake your kid up 3 times a night just to make sure that he wakes up. And that's, I still have parents doing that. I'm like, whoa, okay. Now, thinking that I don't have any physicians telling people to do that, but there still is a lot of kind of archaic views out there, and I find it frustrating. At the same time, I also accept, and I also want people also to accept that, as GPs, that's what it is. We're generalists, right? And we have to know a lot of information. I have to know about diabetes and heart disease and ankle sprains, and it really is hard staying on top of all that stuff. So the way that I'm trying to approach it is, hey, I'm going to try my darndest to get effective, appropriate information out there. And offer, when we have CMEs and stuff, and see every couple of years, really hope that we can get a grand round on this for our local physicians. I think that's what we can do. And then hopefully the newer residents and med students that are coming through are getting the more up to date. And I'm confident that that's happening. It's just trying to hit the docs who have been in practice for 20 years or 15 years. And they may not change. That's the other thing. It's hard to teach a dog an old dog tricks and new tricks. And it's unfortunate, but I think all we can do is do these things, right? And try and get our information out there as much as possible. And say, hey, you know what? Here are some resources, and make it easy, make it streamlined, right? Here's a half hour, 45-minute chat on this. This is the diagnostic stuff you need to know, and here's the early therapeutic stuff.
Absolutely, Leslie. I see your hands up.
Yeah, no, I just wanted to add to what both Connor and Steph said, and Connor, it's the same when I was running the in-person workshops. I would co-facilitate actually with a neurologist, and we often did have, that was definitely a gap where we would hear quite, basically, doctors saying, go stay in a room for, a month. And so it was always, you're trying to be, diplomatic, but we would often, we very mumuch worked from the ONF guidelines. So we would even suggest to people, you can take a look at these yourself, and you might even want to, because I suspect there are probably many, family physicians who perhaps aren't aware of those. So just letting them know they exist. But I can imagine, just as Steph's saying, it's got to be really tough for family physicians because they're so busy and there's so much you have to know and learn. It's a lot to ask. As much as I think it's absolutely the family physician should be the quarterback, I can see how that would also be really, really challenging and difficult. So.
And it's also hard when we're talking about, the brain, which is so complex, right? Leslie, I see your hand is also up, so I'll pass it over to you.
Sure, thanks. So just sort of going along with the concept we've been talking about knowledge gaps. So as I mentioned, the podcast I was involved in was Return to Work. And I think there's lots of gaps in knowledge in Return to Work, and partially because it's a complicated topic. And I think the idea of how do you know somebody's ready? How do you plan a return to work? If there's somebody in the early phase, if it's somebody with prolonged symptoms, how do you identify accommodations or limitations at the work? I think there's lots of work to be done to spread the information there. And I think particularly, so not that long ago, I just finished a return to work with a police officer. And, we had a really interesting discussion that with the workplace, they had lots of questions for me around this return to work. It was very novel for them. And so my client and I had lots of discussions that clearly, as a police officer with the line of work they do, he was not the first individual on his force to have had any kind of a brain injury. But, there seemed to be this model that we would look at like an orthopedic injury or a back injury. You go back week 2, you do this, week 4, you do this, week 6, and week 8, you're back full time. And that isn't really the way prolonged symptoms in particular goes with return to work. And so I think there's a lot of a large need for education there around how to do this, because it can be successful. And certainly, as an occupational therapist, the people that I work with are the ones with prolonged symptoms, and we can get some of them back to work successfully, but it requires, a fair bit of time. So I do think, that's an area where there's lots of information that could be shared that could help lots of different people through the process, because it's really tricky.
Absolutely. Penny, I saw you raise your hand. Did you want to chime in here?
I was just thinking about accommodations when we think about return to learn, seeing some similarities between that and return to work. And I was just earlier tonight on a conversation with one of our amazing graduates from the Return to School program, doing a project on, what can we do to universally design accommodation for students? And so there's a lot of talk about universally supporting what is necessary for a few people, but maybe it would be good for everyone in terms of extra time and those sorts of things. So it'll be interesting as COVID has sort of forced a lot of review, discussion, moved everything online. I think about online work from home and online schooling. I think there's some space there, and there are some gaps, I think, in terms of we need to be individualized, but could we also look at some universal solutions to ease those high stake conversations that students are having to have with a brain injury on board? And it's really difficult to navigate the system anyway. But when you've got to navigate it with a brain injury to get your accommodations each and every time, and it's shifting and changing, and we're, many of us on this call having to rewrite accommodation supports and refresh as these students transition from one level of learning to another. So my hope is, I guess, that we will get to a place where we can do some universal instructional guidelines that would really be beneficial. Like an example, I would say from my own life, because we all work in concussion here on our outpatient team, we'll go into meetings that are in rooms and someone will turn the overhead lights on, and one of us will come in and turn them off if it's natural lighting, because we just know that's just concussion friendly, and it's just a universal thing, and people don't need to work under overhead fluorescent lighting. We don't need to do that. So there's some simple solutions here where there are gaps. So I like to think about that, and I've got some wonderful students who've turned their experience with concussion into a lot of really amazing research projects that are, Western doesn't know this, but they're on their way to talk about how to make online learning more universally friendly for them, and I think for others, not just with concussion.
Absolutely. Becky, I see you want to add something as well.
Yeah, I just want to kind of ditto what Leslie was saying about the return to work piece as well. I find that is probably one of the hardest parts about patients who are injured, have prolonged symptoms. They feel like they're ready to get back to work. And there's just so many complicators, so many factors, so many players involved. There's LTD, there's a rehab consultant usually, there's me, there's the physiatrist. There's so many players involved, and it's so complicated, and each job is so different. Sometimes I have two people going back to the same job, same place, and they get treated so differently by either their occupational health and safety or something like that. And so it's so challenging. We, again, also find that the gap in information that's good information is really hard, right? You can Google anything and you can get lots of stuff that's out there, but a lot of it's not always great information. So we actually had some foundation funding to develop at St. Joe's. We actually developed some very short video clips on our website to try and hopefully that people could, that if a family physician can't spend 45 minutes educating the patients on what to do next, how to go about coming out of rest and being successful with it. No, just go to the website. The website has the videos. Just watch the videos because Parkwood's made them already. So we hired actual video people coming in, lighting, no hair and makeup though. So I was a little mad about that. But we had these really professional videos made. They're short and sweet. People can watch them quickly and they cover all the stuff and we actually polled the patients. What, if we pick 7 topics, what topics would you like to hear about first? Or what would have helped you at the beginning? And so they gave us the information that they wanted to hear at the beginning. And so we made all these videos for them. So I usually say even if we can get people to pass that along or get the family docs to give that information to the patients, they can then go watch it or their family can watch it and then pass along the information as well. So trying to fill that knowledge gap of not making the mushrooms, right? We call the mushrooms are the people who are left in rest, left in the dark basement to fester and not do anything, right? So we don't want mushrooms anymore. We're trying to get them out of that state as well.
It's just a recipe for depression.
I love it. Right? I love the mushroom. Yeah.
Yeah.
Exactly.
Recipe for depression.
And I love that you mentioned the video aspects. I think, what COVID really taught a lot of us, or almost forced it, is different, resources and different avenues to learn and to try and find these resources and education, as, we can't really, do what we used to or go see people as frequently as we may like. Leslie, I saw that your hand was up. Did you want to add something as well?
Just as I was listening to Penny and Becky as well, one of the individuals, I think, as I mentioned, was a university student doing a project, and she was speaking exactly to this whole point of, trying to get accommodations at her university. And it was, I wasn't clear on all the details, but it was this idea that she was having to deal with multiple different people and, in the midst of post-concussive symptoms. And that is really difficult. So I think I love the videos. I think that's perfect because, generally when people are recovering, they can't take a lot of, just as you say, light or do a lot of reading, that kind of thing. And it's unfortunately, and you see similar things, in the motor vehicle accident world where they're sent, forms and forms and forms and things they have to read through. And it's really challenging. So yeah, just kind of adding to that.
And when you add, reading through those forms with the brain injury, it makes it that much more complicated. Connor, I saw that you want to chime in here.
Yeah, just while we were on that topic, it's just coming to mind that so many, especially of these younger people, high school age, university age students specifically, they're on social media all the time anyway, right? I think that's a lot of times where we need to be meeting them. And I think this platform of podcast is another way that a lot of younger people get their information, right? They're doing a workout or they're going for a walk with their dog, and that's where they're consuming their content. And they may not find, for example, the Parkwood website, but if we could maybe get that onto Instagram or something, they're more likely to find it. So I don't know if anyone has any ideas of how to disseminate that more. I mean, obviously Headsup is doing a great job of that. So that's what you guys are, you're killing it with that. So keep doing that, because I think it's super helpful. But I think that's really where we could meet a lot of these younger people.
TikTok. I have 4 kids. And I'm going to tell you that was a discussion point in another conversation about concussion, about TikTok, which I say tongue in cheek, but you're right, Connor. You got to meet people where they are. And I know Leslie had brought up the ONF guidelines, and there's such great work there on the patient version. And some of us got to be involved in those guides. And I think that the patient copy of that, the version, is so great to kind of help get information into the patient's hands, and with support of physicians who understand. That's great. I like your suggestion, Connor. That seems fun. Social media.
Yeah, I definitely can attest that, as we've been on this journey for Heads Up Can, social media has been a big avenue to connect with people and to get our stories out and, the stories of our advocates. And, when I think back to when we started back in 2017, when there was really not a lot of people on social media to now where so many more people are starting to share their experiences. It's really inspiring. And I think we are making that, the right moves towards getting more awareness through these platforms. And, Heads Up Can has been a really great way for us to continue that movement. And so I do think that there's a huge avenue to not only help people that, may be struggling in silence, but to educate and inform people that never really dealt with the injury directly. And I think that actually, is a perfect transition for my next question. And there's so many questions I want to ask all of you, but obviously, with the interest of time, I'm going to cut it down a bit. And I think one of the most apparent things that was throughout this entire project is we had some amazing panelists in every episode that were brave enough to share their experiences and talk about some pretty emotionally intense stuff that happened in their life, traumatic stuff. And so I want to ask each of you, why do you believe it's so important for people to share their experiences with this injury?
I was just thinking, so one thing I think is important is that it gives a voice to all kinds of versions of head injury, right? And I think that's important, that there's not one that's the same. And they're on all kinds of different levels of how people are being affected, and so both intensity of the effect on various symptoms, but then there's also the number of types of things in which they're affected. So whether, it's cognitive issues, physical symptoms, feeling nauseous and headaches, all the different areas that the brain is affected with concussion. So I think the more that people share with, hey, this is how I was affected, people are like, okay, I can identify with that. I wouldn't even have thought that was a concussion that I had, but okay, now that I think about it, that might be it. So, it opens up a lot of people's eyes.
Absolutely. Leslie Rattan, we'll pass it to you next.
Yeah, no, I would definitely agree with Steph. And I think I've seen, over the years, with even more severe brain injuries, with people coming together, being able to, kind of open up, share their experiences and hear what other people are struggling with. And I think in particular, the mental health aspect is often, and this was something that came up, of course, during my podcast around support systems, but just the stigma around, mental health difficulties. And, for some people, it may be easier to open up, but for others, that may be just sort of a real sign of weakness. And we know that, when people are struggling, it's going to be much better if they're able to reach out and seek out that support, as opposed to, to hold it in and where it grows and ends up becoming, something much bigger and potentially something more devastating than it really has to be. So I think, I've seen that within our groups with, people connecting and really reporting that was just hearing other people's experiences can be really tremendously helpful, both for the person sharing and for the person that's, on the other end.
Yeah, there's almost this therapeutic experience, and it definitely, helps destigmatize. And that's our mission with Heads Up Can, is to challenge the stigma through very unique projects like this. So definitely can resonate with that. The other Leslie, we're going to pass it to you.
Thanks. Yeah, I think someone tonight in the group mentioned this earlier, but this was the thing that struck me the most about sharing experiences. Is I do think it helps people to feel not as alone, to know that these crazy things that are happening to them have happened to others. And you see this when you have support groups, for example, is that someone further along the journey might be able to share and give hope to someone that there is possibility for recovery and to get through this. And the other thing that I think can be really helpful is just sort of sharing those tips and the advice about, this worked for me. because sometimes those are the best ideas. So I think the lived experience is really important for that. And I think there's a lot of great sharing that can go on with that.
Yeah, I absolutely agree. I think, from my personal experience, hearing what a lot of other people tried, on the mindfulness side, really changed my recovery process. So, absolutely, I very much agree with that. Penny, I saw your hand was raised.
Yeah, I think people need to share their stories for all those reasons. Not feeling alone, not feeling isolated, and just to walk back to the comment I made about peer support, and the really critical element of peers and being able to share. I'm working with some folks in Atlanta, Georgia, who've really formalized peer support and are working now during COVID. They've realized, oh, we could reach up into Ontario, Canada, and abroad, because really we don't have to be in the same city anymore. So what was sort of a closed option for their particular app that they've developed, and some of the amazing work they've done to try to formalize peer mentors and mentorship, I think is now available. Thank you, COVID, in that way. I also know that OBIA has a wonderful peer support program, and I know we've had many patients take advantage of the services there for peer support, and then our patients have gone on and become mentors themselves. So there's real power, I think, in people. Sometimes I say, I know people are doing really well when they say, what could I do to help? What could I do to give back? If I could be of service to someone some different time, I'd like to do that. And that's usually a pretty good indicator to me that they're on that path to what we talked about earlier, that new normal. So I think people need to tell their stories. I hope that we find ways to continue to promote and formalize the peer mentorship, because I think we all unanimously agree. It's just, how do you match people? How do you get them together? So OBIA, again, credit to them. They're doing fantastic work. And some folks I'm sitting on advisory with in the States, Atlanta, Georgia there. I'm optimistic with COVID, there'll be some opportunities to connect and learn.
Connor, I saw you want to chime in here.
Yeah, just kind of going off what Penny said with the peer support, from more of an athletic standpoint, that's the panel I was working with. I think just super beneficial, especially in some of those kind of stereotypically masculine, macho, football, hockey, like some of these sports that are often, and more so now, thankfully, being played by women as well. But traditionally, were more of those manly, tough sports. I think the mental health aspect on those athletes becomes even more challenging, because the stigma is even higher. And I think seeing in this panel, an ex-CFL football player, really high-level football player, talking about his struggles with mental health is pretty amazing, right? Because, he said, I never would have talked about this stuff back when I played. Like, it just wouldn't have been cool, wouldn't have been okay. It's now 10 years later, and he's like, I'm very comfortable with it. And I talk with the kids that he coaches and try to make them more comfortable with it as well, right? So it can come through coaching, and I think it can come through peer support groups. But some of these athletes that are in some of these more traditionally manly, macho sports, where mental health has been kind of pushed to the background, I think those can be really challenging, but I think it is starting to make some forward progress.
Yeah, I definitely can relate to that, because, the thing that I remember the most about my recovery was when I was able to go back to school pretty quickly, but I wasn't able to play football for like 6 weeks. And a lot of my teammates just didn't understand, because I obviously looked fine. But I was dealing, as a kid, I never had anxiety or depression, and all of that began to surface during that time. And, it's funny, as we've kind of all been talking, for me personally, I know I didn't realize that the mental health was directly related to the concussion until I went on this journey and learned more about it. And I think, unless someone else wants to chime in here, I'll move on to the next question, because I think there is this big, alienation thought that comes with the injury. But the one thing that's just so clear from just having this conversation is that there is a community of people that want to help. And, we've talked about the interdisciplinary model. And, there's so many people out there that want to help. And so I guess my question for all of you is, as a community, for people that find it hard to understand the complexities of these injuries, how can we shape a collective narrative that can better help them better understand, how severe this injury is?
I think believe them would be a great place to start. Believe them. I think we need to be solutions focused and put things in front that we know work and that are evidence based, and the interdisciplinary work that we talk about a lot. Helping people to find the best, most efficient pathways so they're not struggling unnecessarily for long bits of time. Early reassurance. And we know that early reassurance is so important to get around people and get them on a path for right supports and those supports nice and early so they're not so long on the struggle bus. I feel like that's a large part. And I'm just thinking back to the comment made about people still getting advice to go into a dark room and stay in the dark room. Like that keeps people on the struggle bus longer. And so those are some things I'd like to add to the narrative from what I heard and what I've learned.
Yeah, I feel like there's a lot of concussion myths that are still very present for people as they're going through the recovery. Leslie Rattan, we'll pass it to you.
Yeah, I think just on a very basic level, I think education, like very basic education, is so important just in terms of the brain, just as I forget who was saying it, but that when you have any kind of brain injury, including a concussion, you can have physical symptoms, you can have cognitive symptoms, you can have mental health issues. And this is all, coming from the brain and as a result of the injury. And then I think the sort of follow-up, especially I think in the longer term with people that have more persistent symptoms, is they need to understand that there's also, interaction between all of those symptoms. And this is where, I think people often, and they often hear, or they've gotten feedback perhaps from certain practitioners who maybe don't really validate their symptoms, or they, sort of brush them off and sort of attribute it to a mental health issue when you need to look at all of it. So, when we were running the workshop, we would very much sort of emphasize that, the mental health issues can very much come from the injury. But as time passes, as a result of the injury and the sequelae of your concussion, maybe you're not back to playing football, or back to school or work. It would be understandable that you probably wouldn't be feeling so great from an emotional perspective. And all of that can then feed back on your symptoms. So I think just understanding, and that's again for probably people further out, but just understanding those basic things that, especially with the mental health pieces, as Connor and you were saying, especially in young males, I've seen it, where people are really resistant because they think that this is something I should be able to control. And if I can't control it, then I'm weak somehow. And so letting them know that, no, this is actually part of the concussion.
Yeah, I definitely wish there was a bit more awareness on the mental health side, because to be completely frank, when I suffered my concussion back in 2014, I just assumed it was just headaches. Like there was so much that I didn't know about it. And so, I definitely think that's such an important message. We'll go to Becky and then to Steph.
So I think the validation piece, what Leslie just commented on, is so, so important. I can count hundreds of patients who would come in for an intake with our team, and we would almost predict what they were going to say. I'm like, let me guess, you struggle with going to the grocery store and you don't like loud noises anymore. And they would look at me like, yeah, how do you know that? Like, yeah. And I would always start finishing their sentences for them. And they'd be like, what? Why does no one else get this? And I try to explain to them, because that's all we see. All we do is manage this. Whereas, again, maybe a primary care physician will see 1 in every 100 patients or 1 in every 200 patients of this kind of diagnosis. So it's about giving education as to where to go for information. That's good. And I really wish that there was a easy way of saying, okay, this is the diagnosis. This is where I go next. This is where I go next. This is where I go next. And almost like a chain, like a flow chart of, okay, here's my injury. I'm not better. Now what do I do? And now who do I call? I really wish there was an easy way of doing that, but because I think Lynn even does stuff differently, and not every place, again, I work at Parkwood, but not every place has a Parkwood. We service a huge Lynn, like our catchment area is huge. But with virtual stuff now, we also have more capabilities of seeing people outside of our catchment area, right? So we can actually do more with less travel time. So it's actually opened the floodgates even more, unfortunately, for our wait lists and our stress levels, right, Penny? But it is a way for us to connect with people. And again, we think we're doing a great job, and we're trying to do research to prove that we're doing a good job with this, but that stuff takes time as well. So sometimes our treatment stuff is way ahead of the research and the evidence, because we are the evidence. We are creating the evidence of this doesn't work, this does work. And so sometimes we're like, we're going to try this. Like we've developed a couple of things where like we put people in weighted compression vests, and we didn't know if it would work. We're just like, well, these people appear like they're not really spatially aware of where they are. So let's try and use this kind of treatment that we use as other kind of diagnoses on this patient. And sure enough, it worked. So then we started borrowing the vest and putting it on other people, and it works. So we were way ahead of that curve, and now it's caught up. The evidence is caught up to it, but we had to kind of learn as we went. So I hope patients also give us patience with trying to kind of muddle our way through it, because there's not a lot of evidence for treatment out there, unfortunately.
Yeah, I think that's a crucial point, because, there is this element as we're still navigating through the injury and how it affects everyone of trial and error. And, we look back to being in a dark room for 2 weeks, and we've learned that wasn't okay. And we look back to not being able to be on your phones. Now we learn we can incrementally do certain things like physical activity as well. So I think that's very important. Steph.
Well, it's interesting because I think there is a lot of good evidence for the therapeutic concept of be reassuring right at the get-go. And actually, I'm going to give a shout out to Connor, who gave a great talk on chronic pain last week or a couple of weeks ago. And, it hit me at one point during the talk because he spoke of, telling people that, one, I believe you, and then two, that you can get better. All right. And I think, unfortunately, a lot of physicians will, a lot of people get a little cantankerous and maybe a little bit pessimistic, and they're often looking for the malingering patient, and who do exist, right? I mean, unfortunately, we've all seen this, but I think it's important to not go that way first. And I often try to remind myself, right? Like, you know what? First, let's believe. And then two, let's reassure. Okay. And then we'll see where this goes. Maybe this is someone who just doesn't want to work. That happens. But at the beginning, let's just work with what we're seeing here. And I don't know. I think as physicians, I try and get that message out there, because I think there is so much, it's so important. Again, it's very similar to chronic pain. Is like, hey, you're going to be okay. And you don't have to say, you don't want to be the liar. Okay. I think so. You say most people are going to be okay. And, the same with giving my vaccines to little kids. I'm not going to tell them it's not going to hurt. Cause guess what? They're not going to come back. But it's, you know what? This is going to suck for a while. But most people make a full recovery. So I really think that's, when I first walk into a room and I see what someone's coming in for, I kind of take a mindful moment. I'm like, okay, where am I at right now? Good. Optimism. All right. And then you listen to the story, and then you go with it. Now it's interesting too, because we talk about, the male chauvinistic sports and that rough and tumble component. Is actually, I see it also, I just want to bring up the part of also the workplaces, right? So you've got those, and I worked in the emerge, and and you don't complain in the emerge, and bad stuff happens, and you're told to just, you're not told, you feel you just have to walk it off. And I think concussions in the nurses, paramedics, firefighters, police, like a lot of these types of careers, people aren't always comfortable, and they're not necessarily afraid to talk about it, but it's just this is no one else's problem. I got this. I'm going to take care of it. And I think it's very similar into the mental health component. Like there is that parallel as that, and I think it's a society where we are seeing some changes. And funny enough, I was thinking about hockey the other day, and that the sport has changed in the last 10 years. Fighting's way down, and the new stars of the game are faster, quicker, skilled guys and girls. And we don't. And I think that's for the good. I think we took a little setback the other day with the injury with Washington and the Rangers, but which is too bad to see. But I think that for the most part, we are seeing some positive changes in sport. They're not perfect yet, that's for sure, but we're going in the right direction.
Yeah. And I think about, where we were 10 years ago, where we were 5 years ago, like we're rapidly progressing. It's just maybe not as fast as the people who are currently experiencing the injury would necessarily want. And I commend your approach of taking that mindful minute, because I think, it's really important for these people with the recovery process to understand that there is a light at the end of the tunnel. It might be really hard to see and it might get really dark sometimes, but as we've seen from, this project alone, from all the people that you talked to in your episodes, people have gone better and have found, to be better versions of themselves nonetheless. So yeah, I definitely echo that. Leslie Burkett.
Thanks. And I just want to start by saying that I thought that, everyone in the group has had some really interesting points about this last question you asked us. And as I was listening, I was thinking, when I originally thought of this question, my mind went in a really different direction in terms of, shaping that narrative. And I was thinking about things like this podcast series and like all the brain injury organizations and the grassroots organizations and the advocacy. And I think those are such important parts to help get the message across. And the other thing I was thinking about too was we can't ignore the star power, right? So if we think of Sidney Crosby and how much the Canadian collective awareness of concussion went up after that, right? Can't speak for other countries, but certainly here in Canada. So I think, not that we wish this to happen to anyone, but I think there's so many different ways that we can work to, help shape the narrative by not just the providers, but by the individuals and all the organizations out there. And I think those are really powerful tools that we need to remember to access.
Absolutely. I couldn't agree more. And I remember when Crosby got his concussion, the wave that it sent, not just to the NHL, but I think to all different levels of hockey, where, a star player, as you mentioned, can experience something. Connor, I saw that you had your hand raised.
Yeah, I just totally agree with that. I all of a sudden got, 10 times the number of concussion presentations to the physio clinic for sure over the next year and a half. But speaking off of what Steph said, just taking a moment as the healthcare provider to take a few deep breaths and kind of reset your own mindset before you're dealing. And I help work with a lot of people that are in chronic pain. And I think there's a lot of crossover and similarity between concussion and chronic pain, and a lot of crossover with mental health in both of those areas. And you as the practitioner need to be a positive, reassuring presence. Like predictably today, everyone that I was seeing was so much better because it was sunny for the first time in a week and a half, right? And we have to kind of be the sunny people in these people's lives, especially during COVID, when literally we may be the only human outside their family that they're seeing between their work from home, helping with their kids' school. They're also a teacher trying to teach part-time because that's what we've agreed upon. And we don't love that they're teaching on a computer because their screen time's not great. And there's a lot of factors right now. And I think just as the healthcare providers, we have to make sure that we are at least being a positive influence and reassuring people that they can get better. And that just because symptoms are lasting a long time doesn't mean that they can't fully recover, because we see people fully recover all the time. And the great majority of people will fully recover, even if it is multiple years of symptoms. So just that reassuring presence, kind of just to echo what everyone said, I think that's always my take home message.
For sure, that reassurance has been brought up multiple times is so important. Becky, I did see you raise your hand. Did you want to add something as well?
I was just going to comment on the Sidney Crosby effect. So we actually have a graph of our referral sources, and we have an arrow pointing to where the hump starts exponentially going up, where Sidney Crosby got injured right here. And so, so we call it the SID effect.
I think, the SID effect is something that's been like widely known in Canada, but to actually be able to show hard data of that spike is pretty fascinating. Now, I know we're getting pretty close to the end of the time here, but I did want to ask you all one last question because, I'm talking to 6 industry professionals and you all deal with and have dealt with in your career so many people with this injury and to help them navigate the recovery process. And so I want to ask each of you, for the people that are listening, what is one piece of advice? And I'm sure there's plenty, but what's one piece of advice that you would give to someone who either is struggling with a concussion or traumatic brain injury or knows someone that is dealing with the injury? And Connor, we'll start with you.
My big one that I don't think enough people hear, or at least maybe not often enough, is that it's okay to have concussion symptoms, and it's okay to still do things when you have symptoms, right? So a lot of people have got this message that I have to do everything sub-symptom threshold. Everything's got to, like, they just keep hearing this term. And it's not really computing because they're like, I have symptoms at rest all the time. So how do I go for a walk and make it sub-symptom threshold when I have symptoms before I even start my walk? So I just take a lot of time with people to describe what that truly means, and the fact that it's okay if you have symptoms at baseline. We'll call those your baseline symptoms. And we're going to start walking anyway, because there is A, B, and C research to show us that it's going to be helpful in the long term. And if your symptoms start to increase beyond a level that you're confident or comfortable with, then we're going to shut it down. And we'll mark down how long of a walk that was, or how rigorous of an activity that was. And it doesn't have to be walking. It could be homework. It could be anything, right? And people have to be confident that it's okay to have symptoms, and that if their symptoms come on, they will come back to baseline and they will resolve. And the more that they're confident doing a little bit of activity where it's starting to push that threshold in a positive direction, the more control that they're going to have over their recovery in the long term.
Awesome. Thank you so much, Connor. Leslie Rattan.
Yeah, I would just, I think, add to that. I think when people are struggling with this, just from a, certainly from a mental health perspective, just setting small goals and, small goals that are achievable and, taking it a day at a time, having that expectation, as Connor was saying, that there may be good days, there may be bad days. But overall, we're expecting that that's going to be trending upwards. So I think that's really important, and not to be constantly comparing yourself to, what you were, before the concussion or where you were at, and, being a little kinder to yourself and acknowledging how far you've come from, right after you had the concussion with the symptoms and moving from that perspective.
Thank you, Leslie. Penny?
I think just continuing on that graduated return is okay. It's not a failure. And we should expect graduated return to school, to work, and to life. And that's successful. That's sometimes I hear from students thinking, I've got to go back full time. And if I don't go back full time, this is somehow, unsuccessful. And so I think graduated return to all aspects of life should be expected. And I feel that's back to the kindness that Leslie was talking about, kindness to yourself, and understanding that you're taking steps forward and you're moving in that direction. I think I'd also like people to know they're not alone. There's a ton of interdisciplinary team members, speech language pathologists and neuropsychologists and physicians and physio and occupational therapists. And they're all, willing to help. And I think it's just, we've got to find some good pathways for that. But you're definitely not alone. So I think those are the things I'd like to add to the end.
Thanks, Penny. Leslie Burke.
Thanks. I think I think one of the things that I find really important is to tell people to have hope and to not let go of hope, because I think hope is a really important factor in healing and recovery from so many different things. And I think certainly we know that the vast majority of people recover relatively quickly from a concussion, but even for those with prolonged symptoms, recovery is possible, and recovery to have a joyful and meaningful life. Yes, it may be different, but that is possible, and to keep hoping for that and working towards that.
Thank you, Leslie. Becky, we'll pass it over to you.
I think it's what I would love to give home, like hammer home or give as a final piece of advice for patients, is that nothing is guaranteed in life. So you have a path that you're on and you chose your life and you're bombing along that road. And this injury has set a detour in it, right? It's set a roadblock up and you have to go around it somehow. Going around it may take longer than before. It may not be the way you maybe planned to go out down that path. It may not be a smooth road off the path you chose as well, but you can get back to living your life. And it's so important to use terminology like, people say, I can't do that. I can't do this. I said, well, not yet. Like, I can't do that yet. So we actually do a whole series of informational education pieces in our groups where we talk about not yet. That when they're not allowed to say, I can't do something anymore without adding the word yet to the end. Because with practice, with repetition, with more practice, with more repetition, they will be able to do stuff again. And they can still live a life. You can still live a life, even if you have symptoms, even if you have difficulties. And it can be a beautiful life.
Thanks, Becky. Steph, did you want to add something as well?
Yeah, sure. I guess my take home one thing would be, please reach out to your family physician or your nurse practitioner. We want to hear from you. And then if most physicians, even if they may not know the newest information out there, they will be willing to look into resources or will refer to someone who they feel might be more appropriate for their care. And it's okay to advocate for yourself too. So if you do have a physician who may not be providing what you think is, what you've read up on, because we do have a lot of resources. So if, a lot of patients come in saying, I know you don't like when patients Google stuff. I hear that 3 times a day. And it's not true. I don't mind at all. What did you Google? Because let's discuss that. And I think that's where, because sometimes I get something, I'm like, ooh, that's actually a good little nugget. I'll take that. And I think a lot of physicians, like I said earlier, as GPs, we need to know a lot of different stuff. So, we've learned that you have to be a little more open because there are some things we may have missed at some point. And, but start by coming to see us. And then hopefully we can kind of come up with a plan of some sort, and then see you in a week, and then tweak that plan.
Awesome. Thank you all so much. I think, there's definitely this common theme of hope. And I think we've heard that throughout all of our episodes, but especially in this one as well. And I want to thank you all for taking the time this evening to share your insight and provide our listeners with a deeper understanding of the complexities of concussions and traumatic brain injuries. And I truly believe that this series will help shed some more light on the various experiences that come with these injuries, and hopefully bring a bit more awareness and empathy to the injuries as well. I also want to take this time once again to thank the organizations for putting this together: the Headsup Concussion Advocacy Network, the Ontario Brain Injury Association, and the Ontario Neurotrauma Foundation. I think, we all can attest that having people share their experiences is such a great source for awareness and education. And so this episode will conclude the Sharing Experiences with Concussion and Traumatic Brain Injury podcast series. But as we mentioned here, and what's clearly evident is that the landscape of these injuries and the research is constantly evolving, which leaves the door open for a lot more projects like this in the future. And so once again, I want to thank all of our facilitators for taking the time tonight, as well as their contribution throughout the entire project, because it wouldn't have been able to turn out the way it did without all of your help. And I know I, for one, am truly grateful to be a part of a project as special as this, to move put the movement forward of raising awareness on concussions and traumatic brain injury. So thank you all once again. I really appreciate it.